I just wanted to let everyone know, some of you were at the event on Friday. It was very humbling for me to be there on behalf of my union and to hear the stories of so many strong women who are fighting for justice and equality and cooperation. So I just wanted to let everyone know it's so empowering and humbling to be here with you, and we are happy to stand with you as you have stood with us, and will continue to do so. Our union, as I said on Friday, involves a lot of different kinds of workers who do frontline work with the public, and an impact of a strike or a lockout would affect the people of the city of Edmonton as well, who rely on services at the library and at rec centers and licensing, permitting, all kinds of different areas. So we're taking seriously the fact that anything we do as a union affects other unions and affects other workers and affects other non-unionized workers and people in the community. And so we realize that it's important to take a stand. I think the world has become so fractured at this point. Our strength is really in coming together and supporting each other. And I think that's our strength as women and our strength as men who support women and communities together. So we're pleased to stand with you and happy to have your support.
Thank you. Hi. Yeah, I'm an educational assistant here in Alberta. I don't say this very often, but I do work for the Edmonton Catholic School Division. We are going into bargaining this year. We were without a contract for 3 years prior to that, just negotiated one last year, but right back into bargaining again. I like that sign that said, "We who rock the cradle should rule the world," and I absolutely agree with that. Our children in our school systems right now are not being cared for the way they should be cared for. We have went from one educational assistant working with one child to myself having 26 different students I have to work with in a school with, and I'm expected to meet with each one of them every day. It's a very sad situation. Our government decided to negotiate with us last year, but from behind the curtain. They would not come out and negotiate with us. We had to go through the school board to do this. And when you're not looking that person right in the face, you don't understand what's going on. We have situations in our schools right now where children are more than falling through the cracks. They're not even showing up. And it's sad. I've been doing this job for 28 years, and I come home so stressed out and so just feeling devalued, and it's not a happy place. We have people just resigning left, right, and center. They just don't stay because they're there to care for these children, but we have no way to do it. In our local 52A with Unifor, with the Edmonton Catholic School Board, we have over 1,500 members. That's all support staff. The majority of them, about 99.9% of them, are women. None of us, very few of us, have a full-time job. Most of us are working anywhere from 17 hours to 28 hours a week and expected to be doing a full-time job. They call us full-time. We're only 10-month employees, so in the summer we are laid off. We are not on holidays. A number of people tend to put us together with the teachers. We don't make a quarter of what teachers make. So when you hear us out there, and I know all of you people here today would support us, when you hear us out there, us support staff across Alberta, because I know CUPE is, I see my CUPE friends here too, CUPE as well, we need to stand up and we need to tell this government how important women are and how important our children are, and we need to take care of one another. So I thank all of you for being out here today. Thank you for listening to me. Sandra, general strike. Woo!
My name is Jerry. I'm a proud registered nurse with the UNA. It's my first time speaking at a rally, so sorry. So you've all heard this before. The frontline healthcare workers, the nurses, we're tired, we're burnt out, and we're defeated. We didn't give all we got before and during COVID, and our working conditions have not improved, and even after the endemic, in most cases, continue to decline. We continue to face threats and ongoing deficits in healthcare, working with fewer or bare minimum staffing levels, increasing workloads, unsafe situations that put not only ourselves, but our patients' health at risk. We continue to advocate tirelessly, only to face disrespect and austerity from leadership and the decision makers who do not understand but only care about cost-cutting measures that have impact on safety and well-being of our staff and our patients. In many areas of healthcare, like home care, long-term care, and even in the community, we face the threats of privatizations. There should not be profiteering from people's illnesses. Privatization and breaking apart the healthcare system into separate portions will not fix the real issues. All that only creates an illusion that something is being done. It is a distraction from the real issues, and we know what they are, and we have the solutions. Our healthcare facilities are crumbling. Makeshift beds are placed along hallways due to overcapacity and lack of space. Frontline staff continue to be terrified when they come to work because they are put in unsafe working conditions and have an unmanageable workload. The staff to patient ratio is atrocious. And we know safe staffing ratios save patients' lives. And worse, the blame is put on the frontline workers for staff shortages. They say staff taking vacation, money spent on paying nurses overtime. I don't believe such opinions or austerity is made towards any other male-dominated professions who work a lot of overtime. Frontline staff have worked tirelessly to ensure that our patients' basic needs are met, and as such, we miss breaks, bathroom breaks, and mandatory overtime is being imposed on staff mostly working in acute, long-term, critical, and emergency care areas. Our healthcare workers need to be respected, and we need better strategies to retain our people. At our workplaces, we continue to face harassment, discrimination, abuse, and violence. And in certain high-risk work sites and areas, there are no security personnel. Presumptive legislation was taken from us in 2021 by the UCP government, and we continue to fight to get it back. This was taken because we're not considered first responders. This is so demeaning and undermining. To name a few, our nurses work in ERs, air ambulances, ICUs, and they perform palliative sedation in the homes. They are clearly at risk for PTSD, but the politicians don't see us having the need for presumptive legislation. We want that, and we need that. And we continue to see the negative impacts on healthcare system where there is no access to community support and resources, such as supervised consumption sites, safe shelters. We have seen an increase in domestic violence, homelessness, drug poisoning, a housing crisis, and crime in our communities. All these issues put a huge strain on our precarious healthcare system that lacks adequate funding and which has left us struggling to manage these growing issues that affect all Albertans. Yes, this is a ripple effect. And women, especially marginalized and Indigenous women, continue to struggle to gain access to quality healthcare. We have seen over the years the inefficiencies in healthcare for women, such as the closure of labor, delivery, and maternity units in the rural areas, leading to women having less access to medical help, having to travel further, and being away from their families and community, putting their physical and psychological health at risk. We, as frontline staff and nurses, will continue to make a lot of noise, and we will not let up. We will continue to advocate and fight to protect our publicly funded healthcare programs. That the politicians need to listen to us, they need to have us at the table, and they need to work with us. Because a universal healthcare system is basic human right, and the right thing to do is to defend it. Thank you.
Respect.